Hi, welcome back to the second section of our discussion surrounding urinary disorders in the female client. So we left off speaking about or discussing urinary tract infections and looking at them as they are classified as lower and upper infections. And we discussed the lower urinary tract infections and some of those risks that are associated with them, reasons why, and some basic assessment findings. And then we moved on to the pyelonephritis and the acute and chronic and some of the diagnostics and risks associated with developing pyelonephritis. So what I'd like to do right now is move to nursing care. So the nursing care for the client who's been diagnosed with a urinary tract infection will always involve ongoing assessment. It's important for us as a medical community to minimize or reduce the risk of the ongoing urinary tract infection, either to prevent it from moving upward and becoming an upper UTI, or from preventing anything or complication that might impede renal function long term. And again, the first way we do this as a medical community is initiating pharmacological management, because we know that the primary underlying cause is the invasion of bacteria. So, and again, those meds are, we talked a little bit about them in part one, the different classifications of antibiotics, the cephalosporins, the levofloxacin, and they're outlined in greater detail in this chapter in a nice little graph at the bottom of your page. Once we've captured the client pharmacologically, we also want to assist the client with pain management. And usually the meds of choice are mild to moderate analgesics that would be used. And in particular, we want to pay close attention to the use of the OTCs, the over-the-counter ibuprofens, and acetaminophen. Those can sometimes, again, we're looking for renal clearance and we may have impairment of the renal system. So we caution our clients on dosing with those medications. You'll see nutrition and hydration listed here. It's important that the client continues to maintain a high level of hydration. You'll note in your reading that when we talk about lower UTIs, we just say we increase hydration, but we're not using that 3 to 4 liter level as we do with the upper UTI, the pyelonephritis. If they have pyelonephritis, they're going to definitely, if tolerable, have that increased hydration. If they have a lower UTI, we're going to increase their hydration, but we don't typically give them, we want them to be at 2 liters or greater, but we don't put them on like a strict INO if it's lower. But we just ask them to increase their intake of water, and water is the fluid of choice. I know that out there in the lay world, people make all sorts of concoctions, acidify, and there is literature to support acidifying the urine, but the best fluid for anyone who's suffering from a UTI is water. Water flushes the kidney best. And then also encouraging them to avoid frequent bladder emptying. So they should be voiding at least every 2 to 3 hours while they're